Now let's see the muscles of the leg and foot. So leg can be divided into three compartments. First is the anterior compartment, which contains tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius muscles. Then posterior compartment can be divided into superficial posterior and deep posterior compartments. The superficial compartment in the posterior part contains gastrocnemius, soleus, and plantaris muscle, and deep posterior compartment contains the tarsal tunnel muscles, which are flexor hallucis longus, flexor digitorum longus, and tibialis posterior. Then we have popliteus muscle in the posterior compartment at the level of knee joint. Then we have lateral compartment, which contains Peroneus longus and brevis. This is tibialis anterior muscle, which arises from tibia, fibula, and interosseous membrane, and it inserts over the medial aspect of medial cuneiform. Then we have extensor hallucis longus, which arises from fibula and interosseous membrane, and it inserts over the dorsal surface of the distal phalanx. Then we have extensor digitorum longus, which arises from tibia, fibula, and the interosseous membrane, and its tendon crosses the ankle joint and splits into 4 tendon slips, which inserts over the dorsal aspect of distal phalanx of lateral foretoes. All these muscles are responsible for dorsiflexion of the foot. Then we have Peroneus tertius muscle, which is accessory muscle, and it is not seen in all normal subjects, and the tendon inserts over the diaphysis of 5th metatarsal. Then the superficial posterior compartment contains 3 muscles, which are gastrocnemius, soleus, and plantaris. So as we have already discussed, gastrocnemius arises by 2 heads, medial and lateral head, and from the medial and lateral femoral condyle respectively, whereas soleus arises from the tibia and fibula and interosseous membrane, and both these muscles, they form conjoint tendon, which forms Achilles tendon, and it inserts over the calcaneum. Whereas plantaris arises from the lateral femoral condyle, but then it changes its course and it comes medially between the medial head of gastrocnemius and soleus, and the tendon inserts near Achilles tendon over the calcaneum. There is a difference between the muscle fibers that are present in gastrocnemius and soleus, as gastrocnemius is responsible for rapid forceful activity, whereas soleus muscle is responsible for the postural role. Then we have the deep posterior compartment muscles, which are tibialis posterior, which arises from tibia, fibula, and interosseous membrane, and the tendon crosses the tarsal tunnel. Then it divides into multiple tendon slips, which inserts over the plantar aspect of tarsal and metatarsal bone. Then we have flexor digitorum longus, which arises from tibia and interosseous membrane, and the tendon crosses the tarsal tunnel. It divides into the tendon slips, which inserts over the plantar aspect of the lateral foretoes, distal phalanx. Then we have flexor hallucis longus, which arises from fibula and interosseous membrane, and the tendon crosses the tarsal tunnel, and it inserts over the distal phalanx of great toe on the plantar aspect. Then we have lateral compartment muscles, which are Peroneus longus and brevis. These are responsible for eversion of the foot. So Peroneus longus is the larger muscle, which arises from the fibula, and then its tendon courses through the posterior to the lateral malleolus, and then it takes a turn. It enters into the plantar aspect of foot. It crosses the entire foot, and it inserts over the lateral aspect of the medial cuneiform and base of 1st metatarsal. Then we have Peroneus brevis, which is a smaller muscle, lies deep to the Peroneus longus, and its tendon courses along with Peroneus longus, but it does not change its course, and it inserts over the base of 5th metatarsal. And this insertion site is a common site for avulsion fracture in cases of inversion of the foot. Now let's see the sequential MR images. Let's start from the level of knee joint, where we are seeing both the head of gastrocnemius muscle. Then we have, now we are moving down, we can see popliteus has started appearing. As we are moving down, we can see tibialis anterior, extensor digitorum longus and in the anterior compartment, and peroneus longus in the lateral compartment. As we are moving down, we can see soleus muscle. Now we can start seeing tibialis posterior and flexor digitorum longus, which are deep posterior compartment muscles. Now we can see extensor digitorum longus as well as extensor hallucis longus in the anterior compartment. As we are moving down, we can see Peroneus Brevis has started appearing. Now we can see both flexor as well as extensor hallucis longus muscles. Now we are approaching towards the level of ankle joint. Now Soleus muscle, gastrocnemius has already formed the tendon, whereas soleus muscle is converting into the tendinous part, and this is the formation of Achilles tendon. Here we can see this is Achilles tendon, this is Peroneus brevis, and we can see this is tibialis posterior tendon, this is flexor digitorum longus muscle, flexor hallucis longus muscle, and these are tibial neurovascular bundle. As we are moving down, we can see the tarsal tunnel tendons and tibial neurovascular bundle. Now we can see well-defined Achilles tendon, and here tibialis posterior, flexor digitorum longus, tibial neurovascular bundle, and flexor hallucis longus. Here we can see Peroneus brevis and Peroneus longus. This is Peroneus longus tendon. So now we can see all the three tarsal tunnel tendons here, and these are Peroneus longus and brevis tendons, and we can see Achilles tendon has inserted into the calcaneum. Now let's see the muscles of the foot. So on dorsal aspect we have extensor hallucis brevis and extensor digitorum brevis, whereas on plantar aspect we have 4 layers of muscle groups. So the first layer contains abductor hallucis, flexor digitorum brevis and abductor digiti minimi, whereas the second layer contains quadratus plantae and lumbrical muscles. The third layer contains flexor hallucis brevis, adductor hallucis and flexor digiti minimi brevis. So here we can see this is flexor hallucis brevis, this is flexor digiti minimi brevis, and these are 2 heads of adductor hallucis. The fourth layer, which is the deepest layer, contains the interossei muscle, which are basically seen between the metatarsals. Now we can see the sequential MR images. Here are the muscles of the first layer: abductor digiti minimi, flexor digitorum brevis and abductor hallucis, and we can see quadratus plantae, which belong to the second layer. So as we are moving distally, we can see all these muscles, and on dorsal aspect we can see extensor hallucis brevis and extensor digitorum brevis. Now we can see flexor digiti minimi brevis, and flexor hallucis brevis, and now we can see adductor hallucis. These are interossei muscles, which are seen between the metatarsals, and these are lumbrical muscles, which are seen between the flexor digitorum longus tendons. So this was all about the muscles of leg and foot, and thank you for watching the video.